Okay everyone, this is my week 20 pregnancy video post weight loss surgery update, and this is going to be all pregnancy related information. So if that's not where you're at and you don't want to hear it, then click off. You don't have to listen to it. But for those of you who are pregnant or looking to become pregnant, I just wanted to document my journey through pregnancy. So obviously I'm 20 weeks in and this is the first pregnancy video you're seeing. So let's recap the whole first 19 weeks. So basically my first trimester was fairly uneventful. I did get nauseous, but my doctor was able to prescribe me a medication that was safe for me and the baby, which really helped and was such a blessing because I do home health physical therapy, and so I'm in and out of people's homes all day long. And some people's homes really smell horrible. I mean, really bad. And even before I found out I was pregnant, I'd gone to somebody's house and it was a really foul smelling house, and I was dry heaving, and I felt so embarrassed because I didn't understand what was wrong with me, and I was like, and I didn't want this person to feel like I was saying something about their house, and so I'm feeling bad because I'm dry heaving because of the smell. And so thankfully this medication my doctor gave me worked really well. I was able to take it every 8 hours, which honestly there were very few days even through the first trimester that I took it more than once. So that was really helpful. And other than that was kind of the hardest thing. I will say, and this is something I think that relates to every pregnant lady, but I think it relates even a little bit more to us weight loss surgery people, because I had horrible constipation. I've had horrible constipation anyways, but since pregnancy it has gotten really bad, and there's really nothing that can be done for it. I mean, I'm taking fiber, I'm eating right, I'm doing all these things, doing Metamucil once or twice a day. Nothing was really helping. So that was something that was actually really hard and really a struggle. Again, more so through the first trimester than where I am now. Trying to think if there was anything. Honestly, there was no cravings. I had no food aversions or anything. So truthfully, you didn't miss much on the first trimester. Weight-wise, I was able to maintain my weight of 155 pounds through the entire first trimester. And I'm now week 20, I actually weigh 162 pounds now. So my doctor's very happy with that weight. So I did want to go back though and talk about my first visit I had with my OB once we found out we were pregnant. As it relates to weight loss surgery people. So she did the whole workup. I had blood work done. We had a lot of talking. Obviously, I had a lot of questions for her. If you hear that clicking, that is my dog walking through. So anyways, so she was very impressed with my lab work. She told me that all of my vitals, all of my measurements of everything, she said it was better than hers. So she was really happy with that. She said, you're absolutely a healthy woman to carry this baby. She also said something that was really interesting to me, I guess, is that she said, because I was told, after surgery, I was told that I would be considered a high-risk pregnancy, period, just because I've had weight loss surgery. Like, that's it. I'm going to be considered a high-risk pregnancy. So talking with my OB, and after she, did all the workup and everything, she said, I'm not considering you high-risk pregnancy. She said, you are healthier than most women who are pregnant, that to classify you as high risk when you're not, she said, I'm not going to do it. She said, now, if further along in your pregnancy things start to happen, or, there's problems with the baby or whatever, then she said, then we'll readjust and we may consider you high risk. But she said at this point, she said, you're doing amazing and I'm not going to consider you high risk. So I thought that was really nice and very encouraging to hear. So week 20, I have started to feel her move, and I don't think I told you guys, but her name is Isabella Marie Collins. So Isabella has started to move. I actually started feeling her about week 13. I felt like the little squirmies in my abdomen. It was very bizarre, and it generally only happened when music would start. I don't know if like the sound or the vibration of the bass or whatever it was with music. She still seems to really like music. So I did start to feel her around week 13. We found out we were having a little girl at week 16 at an ultrasound, and this coming week on it's set for Thursday. I have to call because something has come up with work that I might not be able to go to that appointment. So, but we have our week 20, which it'll be like week 21, week 22, anatomy ultrasound coming up just to kind of take measurements, make sure everything's going okay with her at this point. So, so I'm starting to feel her move a lot more. I'm starting to feel her with a little bit more powerful kicks, and all I can do is every time I feel her move, I just smile. It's just such a fascinating thing. So, so far everything has been going good. I do have a lot of, I wouldn't say cramping necessarily, but definitely like an achiness in my abdomen, and I know it's since I've been feeling it periodically as I'm growing and as she's growing, so I know it's just kind of like growing pains, but I've been feeling a lot of that. She sits very, very low in my pelvic region, so it's just achy. It just hurts sometimes, but other than that, everything's going good. I'm gonna back up and show you guys a body shot of what I look like, and then we'll be done with this video. So let me see if I can, you know what, let me angle you down a little bit. Sorry. Let's get a nice good close up there, right? Okay, so here's me from the front, and then here's our little Isabella girl. So yep, she's getting bigger. I am starting to get more back pain every now and again, just because she's getting bigger and I'm getting bigger, and we're all just happy. So anyways, all right, I'll get off of here. Thanks for watching, and I will be back to post another update video soon. Bye guys.